For today, I'm really excited to talk about getting to 92%. So Keswick Multi-Care Center is a skilled nursing facility plus much more in Baltimore. They hire nursing assistants, which has significant overlap with the workforce working in home care. And that organization was able to get to 92% COVID vaccination coverage as of last week. 92%. I think it's phenomenal. And that's why we've invited Ms. Carmel Roques to talk to us. She is the CEO and president of Keswick. She is one of my favorite people and has this remarkable 30-year career leading and repositioning senior care organizations. So her contributions to the field far exceed what's written down here. But just to review, she has many areas of expertise. She's a licensed nursing home administrator, licensed clinical social worker. She's had many, many leadership roles, but what's most relevant for this audience is that she has home care experience. So she was the director of home care and adult daycare for Catholic Charities of Baltimore. And so we've invited her here to talk about the approach they took at Keswick and help us translate the lessons learned from the approach you can take in a long-term care facility to the approach you can take within a home care agency, given that the workforce is so similar. So thank you for being here today. She's a board member at Lifespan Network, Greater Baltimore Committee, so on and so forth. And again, this is like a teeny tiny snapshot of all the things that she's done, but let's move forward. Whoops, we're not ready for that yet. We're gonna stop and I'm going to search the beautiful faces to see if Carmel can.
I'm here. Can you see me?
I can. What a beautiful backdrop today.
My office, and the most important part is the map of Baltimore. With all the zip codes and the tiny neighborhoods, which we're going to talk about, micro interventions.
Absolutely, absolutely. Well, thank you for joining us, Carmel. Why don't we start with you telling us just a little bit about Keswick Multi-Care and what kind of skilled nursing facility is Keswick and what makes it different from other skilled nursing facilities?
So first of all, I'm so happy to be here with all of you. And Charlene, thank you for that introduction, and right back at you. So Keswick is a 242-bed nursing home, which makes us one of the larger nursing homes in Maryland. And the folks that we care for come from sort of the northeast region of Baltimore, but sometimes beyond, depending on which hospital system they've been associated with before coming in or where they live in the community. Most of our residents in our nursing home are poor by virtue of having become elderly and sick or have had lives of poverty. And more than half of the majority of our residents are elders from the African American community in Baltimore. Now, we have kind of a unique organization in that Keswick's been around for 135 years, and we have an endowment fund that's grown into a significant foundation, and it has supported our nursing home and our adult day program to really provide what we believe would be programs and amenities and physical environment to support quality of life for people. So we have all private rooms, and we've had all private rooms since the buildings were first built. We have a lot of, in our trade, what we would say is non-revenue generating space, which means we have an auditorium and a chapel and an art studio, a very big rehab gym, and lots of space for people to communicate and mingle. And we're able to do this because all of you know that Medicaid does not cover the cost of care in Maryland's nursing homes, and Medicare just barely covers it. So we're able to make this happen because our foundation provides this grant, this subsidy every year to make sure that we can have just the best of the best for the people who we are, so privileged to be entrusted with their care. it positioned us when we entered the pandemic a little differently than other organizations, because it meant that we were able to afford to do things like go out onto the black market and buy PPE. And we were able to pay COVID pay to all of our employees, not just our clinical staff. We were able to create a separate COVID unit for people who were positive and had the disease and were active in the disease process. We were able to do things like provide transportation for our staff who typically would ride the bus, and that was a dangerous thing for them to be doing. And so I'm really aware that we sort of started out our pandemic experience in a different way than a lot of organizations, but primarily what it allowed us to do was to be able to say to our employees the most important thing. And I'm the one who was saying this to them, and then this was pushed out through the organization. The most important thing is your health and well-being, because your health and well-being is what our residents depend on for their health and well-being. And so keeping you safe during this terrible pandemic, and it extends into your communities and your families, is our primary goal. That's what we want to have happen. And then because we were fortunate enough to have the resources from the foundation, we could then do things that demonstrated we were absolutely going to walk the talk. And our employees had had some experience of that being true anyway. So there was trust there, but we had trust built in because of this relationship with our employees. And I said in one of the previous workshops, you know, I think culture, leveraging culture in your organization. If you have a culture that's based on respect and appreciation for your employees, your staff, is one of the really potent things that you can use to begin to have some impact on vaccination hesitancy. And then the whole other thing we do besides our inpatient service lines, of course, is we're in the community, very active in the community with community-based programming. And we took the same approach with our Keswick Community Health Programming as well, and worked with our local providers to go into people's homes and try to make a difference.
Well, that is incredible. Keswick went above and beyond to really care for its workforce during the pandemic with resources that a home care agency typically would not have.
Right.
And so why don't we take a step back and look at how you decided to approach offering the COVID vaccine to your staff once it became available. I know that in our conversations, you told me that you anticipated that there would be some hesitancy. So what are some of the steps you took even before you launched vaccination to introduce the concept of getting vaccinated to your staff?
So one of the things that we did was, you know, when the state declared an emergency, we went into that emergency mode. And so we spent a lot of time, the leadership and management team talking together about kind of trying to sort through how can we approach this in the best possible way. And we knew, because our staff come from some of the hardest hit communities with COVID, very high death rates, very low support of any kind from systems that we would hope would be more supportive. We knew that there was a likelihood that our staff weren't seeing a lot of people in their communities taking the vaccine. There was vaccine hesitancy in their home communities. And we knew that they weren't going to take the vaccine just because, like, we told them to. So we started with the assumption, this is not about mandating this and shaming people and browbeating them and you must. We started with the idea that And I learned later, Charlene, we were like right doing the public health thing really well. Just based on sort of an intuition about our relationship with our staff, we thought, we got to give them, we got to kind of warm them up. So we started putting posters around that sort of celebrated the vaccine being available. And we started talking first in very top-down kinds of meetings where this is a mandatory, all staff meeting, and you have to come to this one meeting. This is the one thing you must do. And we're going to give you some handouts that are in simple lay people language, talking about the vaccine. And, you at least will have that basic information. And then we took the approach of we need to be able to gather with our staff in much smaller groups where people would feel more comfortable saying what was really on their mind. And so we did that. We did team huddles, and we did, and when I say we, I deliberately stayed out of all this because my thought was the last thing, beyond the work that I did and just my visibility around it, I didn't want staff to feel intimidated by the CEO being there. So these smaller groups and these sort of team approaches were with people's direct supervisors or managers. And then we moved it even further, and we identified folks, and this is where this trusted messenger model is so effective. We identified people on our staff who the other staff members were comfortable talking about what they felt and what they knew or didn't know, and asking questions, and sort of having a chance, a safe space really to feel respected and comfortable while they process this. I think we figured out that as much as the facts about the vaccine, providing the opportunity for people to really process what they were hearing, what they were feeling, what they were seeing in their home communities, what their friends were saying at work, what their pastor was saying. We knew that people needed time to process that, talk about that, and to feel supported in that. Like, that's a really important, legitimate thing to do. Not sort of, I don't know why you're making such a big deal out of this, So we did a lot of this warm-up stuff a couple of weeks before. Actually, we had almost a month before we knew we were going to get the vaccine. And then we scheduled the clinics on campus. And Charlene, stop me at any point if you want me to talk about another part of this. But we scheduled our clinics, and people had to sign up for them because you only got a certain amount of the doses. And so we had the Pfizer vaccine, and we were working with CVS, who really didn't quite understand mass vaccination as a process, but that's okay. We got all set up, and we made the day of the clinic festive and kind of fun and relaxing. And we had actually the experience of seeing people who had not signed up to get the vaccine see their friends getting the vaccine and deciding that day that they were going to get vaccinated, that it was okay. And in some cases, it went way beyond just seeing their friends getting vaccine. And, I was down there, and the whole management team was down there, and we were trying to be as helpful and supportive as possible. And the person checking them in knew everybody's name. So we have 300 staff we vaccinated. Knew people by name, knew which unit they were from, and that helped. But I actually saw nursing assistants take other nursing assistants' hands and walk them in and sit with them while they got their shot and comfort them and tell them it was going to be fine. And there was, like my saying, I got the shot, it's okay, just didn't matter compared to a coworker doing that with them. So we moved on to try to use that as much as possible in encouraging our our staff. And, you know, as we continue to go along, we had a second clinic. So we had people the first time said no, but they watched what happened to the people who were vaccinated the first time. Some of them, you know, went home and talked to trusted folks in their home community, I think, and that helped. And so the second clinic, we picked up a lot of the stragglers the first time around. So they had that period of time to continue to process and to talk to people they could trust. Our medical director was wonderful. He's on site every day. The staff work with him regularly. He's a person of color. He did a little video for people who couldn't come to actually visit with him. He made himself available to talk with anybody who wanted to talk about their concerns. And we still have some people who have said, I'm not getting vaccinated. I'm just not doing it. And we've gone out of our way not to shame them or browbeat them or make them feel like they've done a horrible thing. And I'm starting to see that happen. You know, as we've gotten further into vaccination, I see some other situations, not here at Keswick, where people are getting treated poorly because of their choice around this. And it just doesn't pay off. I think when you do that, people just feel more isolated and othered and more likely to just stand their ground on this. So that's kind of a lived lesson, you know, just watching that dynamic and understanding people who don't want to get vaccinated, they have their own good reasons for not wanting to get vaccinated. And I think the emphasis there is good. Their reasons are good reasons. They're good reasons for them, even if they contradict science and all of that. And you have to kind of start there with people. So that was very effective for us. And we didn't have to pay people to get vaccinated. We reduced all the barriers, you know, by it was here, it was on site, it was made, it's free, you know, we loved people up, but we didn't have to do other kinds of things to get that vaccination rate so high.
You mentioned that the medical director served as a messenger sharing information about the vaccine with staff, and that it was, as a medical director, he's a physician.
Right.
You also mentioned that he had relationships with the staff. Do you think that bringing in an expert physician, if he hadn't already been connected to the staff, would have been a powerful way to influence nursing assistant decision making about getting vaccinated?
That is such a great question, and I'll share my personal lens on that. My employees are almost all African American or African, and they live in Baltimore, and they come from a city that has a very, very difficult and challenging history when it comes to the healthcare system and its treatment of people of color. So I think it's why, as an old white lady, I understood I would not be the trusted messenger. I mean, my staff know I care for them, I pay attention to their lives, but like, I don't live in their neighborhood, you know, I have a different life experience. I'm a privileged old white lady. So me getting up and saying, oh, you should get the vaccine, had limited impact. Dr. Saluja had more impact, I think, because he already had a trusted relationship with the staff. So it wasn't so much that he was the expert, although that mattered to some people. I mean, like, they trust his knowledge. But it had more to do with he already had a good relationship with the staff. Many of them are his patients. So I don't think just any old expert showing up and saying, this is good for you, you should do this. You know, it's like Dr. Fauci, yada, 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 you know. People, I think, were much more likely to listen to him because of his relationship, his prior relationship, which all goes back to this the micro interventions, the trusted messenger intervention, the relationship intervention is the most powerful tool we have. And as a public health person, you know, Dr. Brown, I know I'm preaching to the choir. This is how care is provided across most of the world, with trusted community health workers going in and, you know, working in communities with the community elders or whoever, you know, to get some uptake. And so we sort of saw a microcosm of how that can work in the nursing home. I know that our home care agencies have a totally different experience, having run a home care agency and an adult day program, where you don't necessarily have that ability to gather staff to provide the resource for them in a kind of low, you know, barrier way. So I think it's all that more important that you try to find the people on your staff who can influence other staff members and almost buddy them up if you can. Figure out, you know, give people a peer buddy who's informed enough and comfortable enough talking about things to help them through that. I think using something like a video from a trusted care provider who they know might help. You know, I think there were people who watched the Dr. Saluja's video who that was how they got their message. And probably they watched it with their neighbors and their family. And then they all chatted about, was this a good idea? So I think that you can leverage technology a bit probably. And then the thing that I'm focused on right now and talking with some folks in Baltimore about, because we were fortunate to get a Rockefeller Foundation grant to do this work, which is these micro interventions in literally, you know, a block at a time. And I'm talking with the people who are doing that work about, is there a way you can let me know, or I can find out where these micro interventions and targeted kind of things are going on in people's home communities, so that if my staff live there, I can kind of put that forward as you know, a resource for them. Because it's different when it comes from people in your community. And what we've been up against is our staff lived in communities with very low vaccination confidence, very high rates of death, very low rates of PPE testing, you know. So that had to be kind of overcome in some way. And I'm pretty sure that's probably true a lot of the home care staff as well.
Yeah, you are correct about that. The hesitancy cuts across senior living and home care, and it's a real struggle for agencies who are working to increase vaccine uptake in their frontline staff among the caregivers that work with the families that are their clients. Mm-hmm. As I was listening to you talk, there were a couple of things I wanted to invite you to describe in a little bit more detail. One, you've used the term micro intervention, and that's a term of art. If you could clarify what you mean by I mean, obviously micro intervention, small intervention.
Well, so, you know, one of the things that my bias toward community and home comes up when I talk about this, because our hospital systems decided that they were going to be really helpful, and they were going to bring mobile units into neighborhoods for vaccination. And there they were, you know, in the neighborhood waiting for people to come get vaccinated. And there wasn't like a big surge of people like thrilled to see them and running up to the hospital, you know, van to get their shot. And I thought, well, okay, so that didn't work really well, did it? So the issue was they hadn't gotten to the next step, which any good public health person would have told them. you have to go talk to the barber and the beautician and the pastor and the granny. A lot of blocks have a granny. And, and literally block by block, figure out who are the influencers and talk to them about helping people get vaccinated. Because people aren't going to come just because you showed up with the vaccine. And so that's the kind of, it's very targeted. It's like, and it's based on, you have to actually get, you have to actually get into the community and talk to the people who live there and let them tell you instead of having an assumption about it. So it's getting more and more refined in that regard. This recognition that, these are communities, they have leaders, they have a whole highly developed social network. And if you go talk to somebody, and usually it's the church pastor who can really help you get it rolling. Sometimes it's the barber or the beautician or, somebody who does daycare, So they'll tell you what you need to do or how to go about it. And they can be influencers. And so that's the more micro targeted, intervention that's starting to happen in some parts of Baltimore because of this additional funding that came through.
Wonderful. So now let's translate all of this into the industry in the world of home care. When you think about a micro intervention and you're describing sort of outreach and community-based efforts that are going to be beyond the scope of what individual home care agencies can do, but you also described a series of micro interventions that you implemented within Keswick, so within an organization. And I'd love to hear if you take off, put your Keswick hat on the table next to you and put back on that home care hat and I'd love for you to process out loud some ideas about how to translate the strategies that worked in the long-term care workplace that people attending the workshop can take with them and explore applying in the home care workplace.
So I think what I would do with my home care staff one thing that would be similar would be to have a very clear North Star. Your safety is the most important thing. Now, if that is a lie, or you don't really feel that, saying it is not going to help. But if you truly believe the safety of your staff is the most important thing, and you can say that to them, then say it. Be explicit about it, be direct about it. And then I think this idea of beginning to push information out, but in a very low-key, sort of non-threatening way. One of the things I talked about in the last workshop was we avoided using people images with the messaging about the vaccine because we were trying to neutralize some of this sense that many of our staff have, which is, oh, you're just, I'm a Black woman and you're going to experiment on me again. And if the poster has a happy Black lady on it getting experimented on again, that's a big turnoff. So we did things so that the posters had animals and cartoons and different kinds of visuals that went with the message that being vaccinated, can bring you a sense of security and comfort, the good things. And just getting that sort of out there. So I think you can do that. You can either do it virtually with your staff, with their, iPhones or cell phones, or you can do it with actual hand, stuff. I don't know if you send your folks things by snail mail or however you want to do it, put it on the website. So I think that's something that would work with my home care staff. And I think the other thing that would then work is, and this, I would use my scheduler, because we used our scheduler at Keswick, who is the person who structures this, sends people their assignments. And so she knows the staff. Frequently, she's the one they call off to, and so there's a whole, she knows, that their kid gets off the bus at 3 and there's no way they can take an assignment that's going to interfere with that and those kinds of things. So I would probably try to leverage my scheduler if I can. Now, I'm assuming that most of our home care providers use a scheduler in that way and that it's not all electronic. If it is all electronic, you're just going to have to bite the bullet and use the technology that's available to be able to text and message and to use that to send the same message about wanting them to be safe, trying to find information that lowers their lack of knowledge. So, bits of information, not all at once, a big thing that the CDC and this is and that, just very simple sound bites of information that you can push out. And then the other thing that I think is, we lowered the threshold for the aggravation and difficulty around getting the vaccination because people could get it right here at work. They didn't have to go take off work. They didn't have to drive someplace. It was just come to work and, we'll send you down there when it's your turn and get your shot. So I think about for my home care staff, I would want to find a way I could lower the barrier around that. This gets dicey, but you might want to consider giving people some time off. You definitely want to find out where the most convenient sites are for getting vaccinated and give them that information. So that's some work that the internal management team can do on behalf of staff. And then I think, and this depends on how well you know your staff, or if you're in an organization that has multiple layers, because you have a big home care staff, who knows who? Figure out who knows who and see if you can pair them up around talking about the vaccine. And I would suggest not even talking about getting the vaccine, just encouraging them to talk to each other about the vaccine. And it might all be, I'm not letting, Bill Gates put a chip in me. Well, neither am I, because it's going to affect my baby. You can, whatever it is they want to talk about, but start with pushing them sort of toward each other. And then if you have people on your staff that are not vaccine hesitant or have overcome vaccine hesitancy and are willing to learn how to talk to other people about it, I would say as a home care manager, it's worth its weight in gold. And in fact, you have to pay some gold to pay them extra, to learn about it and to be the champions. And I think those are things that I would do.
Okay, thank you so much. That is wonderful feedback. I'm going to transition to open the floor for questions, but before I do that, do you have anything else to add that you think will be useful to this audience that I did not ask you about?
I don't know how useful it is to know, and I know, Charlene, you're going to teach about this, that having a trusted messenger, whether it's from somebody's neighborhood, community, family, church, whatever, or at work, a trusted messenger, is the single most effective intervention. I know that I have people who took the vaccine who still don't believe anything about the vaccine. They don't understand the science. They are not entirely sure it isn't going to change their DNA or whatever else they've heard. But they took it because their friends said it's okay. It really is okay. Look, I'm okay. Nothing happened to me. You're going to be okay. And so in a very weird way, the facts don't matter. The messenger matters. And I just think we really experience that. And I think it's true in home care. I think it's more of a hurdle to get the connectivity, which is why I think I know the margins are very thin, but I think it's a worthwhile investment to try to identify champions and pay them a little extra to be champions, lift them up, elevate them, and value what they're doing, because they're going to help the company be successful.
Absolutely. So thank you for that. Let's open the floor and invite questions. We're a small group, so you can raise your hand, or you could literally just unmute and start talking. All right, Gary Fink.
Hi. Thank you, and thanks for that wonderful presentation. My question is, how differently or similarly would an organization approach employees if it is going to mandate vaccines? If it's a healthcare organization, what should or shouldn't be done in order to maximize comfort, to minimize stigma, if one is going to mandate?
I just think this is the question of the hour right now, because, you know, in Baltimore, our major healthcare systems who employ thousands of people mandated vaccination for all of their staff. And it sent ripples through the world of healthcare here. And I am pretty sure that the nursing home sector is teeing up to do the same thing. So I'm going to get on my soapbox for a moment. I don't know that this is helpful, but this is the lens I look at that through. As a regulated, licensed healthcare provider, my duty is to protect my staff and my residents. But my primary duty, because I'm regulated and licensed, is to not do anything that endangers my residents. And so it's very, very hard when I have to weigh, and I'm going to talk about the harm to staff from mandating, when I have to weigh my sacred duty to keep the residents safe from harm, never mind all the bad stuff that can happen if you fail to keep the residents safe. Never mind the negative outcome for the resident. When I weigh those two, I come down on the side of I have to protect my residents. And this is a tool that allows me to do that. When I think about my staff, and I just want to say I'm speaking for myself, I'm not speaking for my organization, I'm speaking for my take on this. Because my situation is that my staff is have been in a society that has not valued them or their work forever. The mandating of the vaccine is just one more experience of being kind of slapped in the face. And there's already a lot of trauma for that community of caregivers. And I think it intensifies around being told, no, you have to take this experimental drug, period. And now I'm going to interfere with your ability to have the dignity of work and perhaps pursue your vocation as a caregiver by telling you you have to take an experimental drug. And when you say no, you're going to lose your employment. So that is a horrifying thing we're kind of faced with. And so when I think about it that way, once again, all I can do is my best to help reduce vaccination hesitancy and help them voluntarily accept taking the vaccine, but understand it's a traumatic experience for people. So thinking further down the line how to respect that and listen to that and be ready for that.
Right.
But I think if you don't understand that is what is happening, then you just sort of are jolly going along. And, you know, I think all of us are going to lose some of our most sophisticated, very best staff. And that's really sad. Maybe they'll come back if it's not experimental and they feel like it's really safe, you know, and be willing to be vaccinated. But there are people who are just going to not do this. And it's terrible. It's going to mean they lose their employment. I think that's what we're going to face at Keswick. So many of my staff are vaccinated. I don't think very many of them are going to be in that situation, so I feel better about that. But that's not true, you know, across all of the healthcare sector. Did that make sense?
Yeah, yeah. The premise of the question was exactly that. It is going to be a traumatic imposition, and so for those organizations that do that, the question is how to best, as much as possible, ameliorate the trauma, address it, what to do given that, to try and minimize the impact and the negative effects of that. So,
yeah.
Exactly.
And I think, you know, acknowledging that it's difficult to the person is just shows respect, and some empathy, and that helps reduce it a bit. You know, that you're acknowledging this is really difficult and we feel terrible. And then I think making sure it's understood the door is open for return, that, you know, you're not going to be scapegoated or, you know, taken off the list or whatever, that they can, if they change their mind or things change with the vaccine itself, that they're welcome. But I already see, you know, as I said earlier, I see some scapegoating and kind of stuff going on already, and it's sad. It's hard.
Thank you.
Thanks for that great question, Gary. Are there other questions for Carmel on that topic or any of the other topics that she brought up?
So no one thinks, how much should we pay them to be?
This is a little bit on the same lines of the scapegoating, and because we definitely have a few caregivers who, you know, won't do it. And I definitely have been very clear that I respect, you know, it is your decision and we respect that. But I do have clients who have been pretty, I mean, I wouldn't say they're being disrespectful, but again, I think the caregivers, it just is a touchy thing. The caregivers, any mention of it, they think is pushing them to get vaccinated. And I guess if anyone, or, you know, you've experienced kind of how you handle working with residents or clients, and specifically, I mean, one of my clients loves her caregiver who doesn't want to get vaccinated. And so she doesn't want to get rid of her caregiver. But then they have this kind of ongoing discussion of the vaccine. And
I think that one of the things that you can do for people who have a situation like that, where they want their caregiver to stay with them, their caregiver doesn't want to be vaccinated, is making sure the caregiver knows that, okay, so you decided you don't want to be vaccinated, but there are other things that you can do to protect your client and yourself. Stay masked, you know, when possible, keep your distance, wash your hands, the things that they can do to try to keep their client safe. If your client is vaccinated and they're masked and they're using all kinds of precautions, the transmission likelihood is is much lower than if they're just buzzing around acting like, you know, we never had a pandemic. So I think making sure your caregivers who have the reluctance understand, now, you know, there are these other things you can do to protect yourself and protect your client. It's really important, since you've made the choice not to be vaccinated, that you do those things, and just be very supportive in that way. I have family members of residents who yell at me because, you know, there are people who come into the building who aren't vaccinated. And, you know, we can't ask families if they're vaccinated. And we have to let our families visit. I'm so grateful that they can come visit.
Mm-hmm.
But I mean, it's a very dicey kind of thing. So, and, you know, they want me to put a stop to that right now. And I have a feeling a lot of your clients are like that. And then some just won't have some who's not vaccinated. And maybe there's some education for them to understand,
Mm-hmm.
you know, you can so dramatically reduce the likelihood of transmission that, you know, it's way lower than before when neither of you were vaccinated,
Mm-hmm.
you know. And,
Right.
and now there's some things you can do when you're vaccinated. If they wear their mask, yada, yada,
Mm-hmm.
you've created a pretty safe situation. I think people get a little bit very black and white about it. It's kind of all or nothing. And no, it's not, you know. So.
Yeah, it's funny, you know, they've been working together for a year, and then, you know, and throughout COVID, and then, yeah, and then this happens, and it's like, well, you know, there has been this risk for a long time, and now it is lower. And
it can stay very low.
Right.
And if you have some, Charlene, you probably have more facts about that than I do, but if you can then actually give them some facts about that.
Mm-hmm.
Like, well, now your transmission rate, if you have a mask on and she has a mask on and she's vaccinated, is, you know, 0.1. I don't know.
Yeah.
I think that makes a difference. There's a lot of fear around this, mostly, you know, irrational. It's human nature.
Thank you for that great question.
Yeah, I loved it.
And
we don't see your name on the screen. What's your name?
oh, I'm Erin.
Hi, Erin. Okay, so thank you, Erin and Gary, for these great questions. Yvette, Baraket, and Jocelyn, do you have any questions for Carmel?
I came on a little bit late, and I apologize. But I do see that Dawn Seek is on this call as well. And it was last week we had a private duty meeting of agency owners. I provide non-medical private duty care. I just checked in with my HR manager a short while ago because I wanted to know the percentage of my caregivers that have been vaccinated at this point. My numbers right now, which I feel is on the low end, but it's somewhat skewed because we've included a lot of caregivers that are not actively working on shifts,
Right.
but they're probably somewhere between the 30 and 50% range in terms of caregivers that have been vaccinated. And I just wanted to get a sense in terms of other folks who may be providing care in terms of what percentage of their workforce has chosen to be vaccinated, and what tools or resources they've put into place to get those numbers increased.
That's a great question, Yvette. Carmel, why don't you at least provide context around the vaccination coverage you got at Keswick, since I think
so.
Everyone else, please jump in and share.
We did a lot of work around vaccination, and you know, it isn't just our clinical staff; it's all of our staff,
Right.
our housekeeping staff, our dining staff, maintenance, groundskeepers, everyone. And Charlene, you had my most recent numbers. What did you say it was? 92? it changes bit to bit, because we also must count in our count any agency staff that are in the building. So if we have someone who has a private duty caregiver, or we have an agency nurse or a nursing assistant, we have to count them in our count. And if they're not vaccinated, it counts against us. But our approach, we just took the broadest, most comprehensive, full court press toward helping our caregivers be comfortable with getting vaccinated. And a lot of it, I think one of the big differences really is that we were just talking about toward the end here, which is we could provide the vaccination for them on site at work. You know, they didn't have to go. I had this wonderful person who was working on my house, and I said to him, why? He said, I'm not vaccinated yet. I said, why aren't you vaccinated? I was so worried. He has a new baby coming and all this. And he said, I can't take off work. And I thought, you know, that's awful. That's awful. He has, you know, he can't take off work and go drive someplace. And he's a person who can go drive someplace, you know, to get the vaccine. And I was like, well, you know, you should just leave my house where you're working and go get your vaccine right now. I won't tell, you know. But so I think that's part of it. It's ease of access combined with opportunity to
right on
process.
site, being right there, roll your sleeves up.
Yeah. You know, I think that's really hard for people.
Thank you, Carmel. Would anyone else like to share anything with Yvette about vaccination coverage at your agencies, or things that you've done that have worked or haven't worked as she works on increasing vaccine coverage?
And, you know, I'll just say 30 to 50%. I mean, that's why Charlene's doing these workshops. That's not at all unusual.
Yeah, I've definitely heard about a lot of other agencies, and I'm sure you have as well, that are struggling. Some are even still at 20%.
I think we're a small agency, and so I think we're at about 80%, and that is like, I don't think I did anything very creative, but I definitely drove like 10 caregivers to their appointments, because yeah, they just didn't have reliable transportation, you know. And of course I kind of grouped them, like I had 5 appointments at 3 p.m. at one place, and then, you know, 4 appointments at another time. But yeah, I think just like, and I definitely think I had one caregiver who was like, I'll get it. And I was like, okay, when are you going to get it? And then, you know, I made her an appointment, and I was like, I will pick you up at 1:30, like we're going. And I do think, and she did it, you know, like, like I do think kind of I was a little, I don't know.
Persistent?
Yeah, persistent, right? I guess I was trying to think of a better word. But yeah, I just really have taken that personal kind of approach with our caregivers. And I mean, we definitely still have those who do not want to be vaccinated, and I'm still working on those people.
Yeah, well, we see that we've got still a lot of work ahead to do. So these are, that I like your approach, very hands-on. I don't know what, I don't know if there's anything available to companies like ours where like we could arrange for, you know, somebody to come in from the county, and we can just, where we can say, okay, we've got somebody here, come on in.
I know agencies outside of Maryland have done that.
Okay.
But yeah, I haven't found a way to do it here. But I mean, that would be a wonderful way to do it.
Charlene, are there any
Yeah.
resources out in the community, in the county, that will have a nurse come on site to, perform vaccinations? Do you know of anything like that?
How many caregivers? I think volume matters. So, in terms of like, are you talking about 10 caregivers or 200 caregivers? Do you know what I mean?
No. I would say, and we've got caregivers all over Georges County. But I would say that the number yet to be vaccinated is probably maybe around 40.
Okay.
So one of the things that we were able to do, and I don't know if this is statewide enough or, countywide, but we actually were able to volunteer to be a community vaccination site. So besides separately the things we did for our employees, we've now done one. Well, we were doing Pfizer, so we had 2 clinics, and we have, I think, the J&J coming up in the next couple of weeks. So we volunteered to be a community site, and then the health department organized getting the vaccines to us. And
Yeah, Carmel,
I think if they do some stuff with the local hospital systems like MedStar also, So some of the same folks that are doing these vans, the mobile units, are kind of involved in this. You can become a site.
it's Carmel, this is Dawn. It's not that easy for a private duty agency because you have to have a CLIA waiver, which takes a little bit of time to get.
Yeah.
And as a facility, you have a lot more resources in order to pull that off, which the only thing I can tell you is that I talked to the Department of Health, and they were having agencies sign their employees up in bulk. They were trying to arrange that, and I had sent that information out in my daily emails. The other thing is, I think the CVSs are still, most of the pharmacies are sites, and I like the idea of driving them over and holding them, not holding hostage, but, driving them over and helping them to get the vaccine. Some of the larger agencies have been able to do things like, if you get a vaccine, we're going to put your name in a hat and you're going to win a prize, which always, money talks, and that's always helpful if you can afford to do that. But right now, I think with the large vaccine, most of the vaccination centers are starting to close. I don't know if you know that. And I literally just read now that Governor Hogan is ending the state of emergency July 1st. So that means that probably a lot of those other large resource centers are going to close. And I think you're going to be much more dependent on, on the pharmacies or the health departments. I think the local health departments trying to call and speak to them might be, beneficial, depending on what county you're in. Some of them are easier to access than others. I know the smaller counties, were much easier. I know Howard County was one of them that was ahead of the curve for a lot of this. So I'll see what I can find out that I don't, that I haven't already uncovered, but I think at this point, the pharmacies are going to be the best bet. So however you can get your folks there is probably going to be the best, but I'll look a little bit more into the health departments too.
Yeah, it would be great if they would, do a little pop-up clinic, some place that was central for your employee base.
Maybe you could get those Hopkins and those hospital vaccination
Well,
vans.
that's what I'm thinking, if they're going to move toward this more targeted intervention, it makes lots of sense to go. And who would not want the primary home care employees vaccinated, as much as possible?
Well, it is 5:13, and I know that Carmel, I promised her that she would be able to walk away at 5:10 so as to be in her car by 5:15 in order to get to her next obligation.
Yeah.
We all take a moment and thank Carmel. The cool thing about Zoom is that you can do all of these like fun reactions.
Oh yeah, this is fun. Here, I'll give you some reactions too. Here, this is what I have to say for you.
Carmel, your presentation was phenomenal, and your real world, tangible, practical feedback was fantastic. And so we are thrilled that you were able to join us again. And I suspect that I speak for everybody that
I really enjoyed it. And, you know, may the force be with all of you. We've come this far. We can do it. Take care. Thanks, Charlene.
Thanks, Carmel.